Are you on an osteoporosis drug right now and your doctors have told you that it's 100% safe with no side effects? Hey y'all, I'm Dr. Van, your no BS chiropractor. I wanted to check in real quick. I had a patient come in this morning and we discussed what she's taking right now for osteoporosis. And I'm not here to give you medical advice. So obviously I've got to say, check with your medical doctor and always get advice from them first. But we need to be looking out for our own health as well. I want you to do research on some of these medications if you are currently taking an osteoporosis drug. So here's the way they work though. Here's the information I'm going to give you, and then you do your research and make some decisions for yourself. I just highly recommend that you look at what's going on and how it affects the body. Osteoporosis, that means we have thinning of the bones. So we have two different cells in the body. We have osteoblasts and osteoclasts. Both are used in tandem to keep our bones healthy. We need to continually be making new bone while our body takes away the old dead bone. It's like a recycling of bone. The osteoblasts, they build up the new bone. The osteoclasts, they tear down, and then take away the old dead bone. And if they both work, then we have healthy bones in general. So obviously, if we want more bone density, so if we want to work against osteoporosis and prevent it or try to get better if we have osteoporosis, we need to build more new bone. Here's the thing. Most, if not all, and I'm going to say if, just because everyone that I know of, there could be one that maybe it's new that I've not heard of, but osteoporosis drugs, here's the way they work. They do not stimulate the osteoblasts, meaning they do not help you make more new bone. What they do is they turn off the osteoclasts. So all they are doing is they are turning off your body's ability to take away the old dead bone. Now, logically thinking, does that sound like a good idea? No way. The truth behind it then is if you do that, so again, to reiterate, the drug makes your body not take away the old dead bone. It does not make you make more new bone. So when you go do another bone scan and they say, oh, your numbers are looking better, you're improving. But are you? So the numbers changing, yes, you have more bone. But the only reason why you have more bone is because your body's not taking away the old dead bone. So yeah, you got more because your body isn't able to do its job. Having more dead bone, even if your numbers are, quote, better on your bone scan, you now are at a higher risk of fracture and a higher risk of course, when you fall, having very brittle bones. So the whole idea of taking the drug and combating osteoporosis is to make your bones stronger. And that's where the kicker is. The bone scan simply says you have more bone. It doesn't tell you, if you're on those medications, how strong your bones are in relation to how much bone you actually have. So do some research, check it out. Again, I'm not giving medical advice, but you need to look at what these drugs are doing for osteoporosis. And I guess I'm going to ask you the question, do you really think it's helping you, or is it actually hurting you more than it's helping? Now, on the flip side, real quick, make sure your vitamin D level is optimal. If you're low in vitamin D, your body cannot absorb and utilize calcium like it should. Make sure you're doing some kind of resistance weight training. If you do not use muscles and bones, then you will lose them. You have to be doing something to stress in a good way. Challenge your strength. Whatever builds muscle will build bone in general. And then on that, the last concept is, it's the same reason why when astronauts go into space, even for a short time, when they come back, one of the big risks that they have is their bone density goes down very quickly because they have no gravity. Gravity is a stress on our body, but it's a healthy stress because it makes our body have to keep building bone, building muscle to maintain a certain level. So again, build your bone, weight training, good vitamin D level. There's many more, but that's the basics, and question the osteoporosis drugs. I honestly believe that some people, the osteoporosis drugs in some cases could really put somebody at risk for a fracture with a fall, and we all know how that could possibly end. So if this is you or somebody that you know, pass along the information, go do your research, and make an informed decision on the drugs that you might be on right now. If you have any questions, leave them in the comments below. You're welcome.